Good day to all, guys. So today our last topic for our term two would be all about osteoarthritis, rheumatoid arthritis, and gouty arthritis. This for the concept of orthopedic nursing. So we start out with osteoarthritis. So this type of arthritis, it's associated with the aging process. So if you feel that your joints are already in pain, most probably this is one of the types of arthritis that you might be suffering in, since this is associated with the aging process and it can affect any joints. The cartilage of the affected joint is gradually worn down, eventually causing the to rub against the bone. So this develops as a result of the occasional wear and tear of the cartilages that is cushioning the bones together. That's the function of the cartilage. It is to cushion them. It is preventing the bones from rubbing itself from one another in the joints. But as time goes by, due to the constant wear and tear of these cartilages, this happens. The bone will rub against the bone, causing arthritis. So, bony spurs develop on the unprotected bones, causing pain and inflammation. So, what's the difference between RA and OA? RA is rheumatoid arthritis, OA is osteoarthritis. In OA, the cartilages are affected, while for RA, it is the synovial membrane. So, like what I've said, osteoarthritis is the deterioration of the cartilage and overgrowth of bone, often due to the wear and tear as a person grows older. But for rheumatoid arthritis, it is the inflammation of a joint's connective tissue, such as the synovial membrane, the one I've shown you earlier, which leads to the destruction of the joint's cartilages. So there's an inflammation. What is causing this? Rheumatoid arthritis is an autoimmune disease wherein our body's own immune system attacks the synovial membrane, or they attacks the synovial membrane, which will later on lead to the destruction of the cartilage. So osteoarthritis, I've been mentioning this again and again. It's the wear and tear type of arthritis. It's a chronic condition characterized by the breakdown of the joints cartilage. I also said this earlier that the cartilage of the is the part of the joint that cushions the end of the bone that allows easy movement of the joints. And the breakdown of this causes the bone to rub against each other, causing stiffness, pain, and loss of movement in that joint. Osteoarthritis is also known as degenerative joint disease, osteoarthrosis, hypertrophic arthritis, or degenerative arthritis. Stages of osteoarthritis. Cartilage loses elasticity and it is easily more damaged by injury or use. Wear of cartilage causes changes to the underlying bone. So if the bone constantly rub against each other, they will thicken and cysts may occur under the cartilage. And these bony growths, known as spurs or osteophytes, develop near the end of the bone at the affected joint. So there will be spurs there or some nodes, bony nodules. So bits of bone or cartilage float loosely at or in the joint space. That joint lining or the synovium becomes inflamed due to cartilage breakdown, causing cytokines, which are inflammatory proteins and enzymes that damage the cartilage further. So the cartilage is already damaged due to the wear and tear and brought about by inflammation. This will further aggravate the damage of the cartilage in the joints. So the main problem in is in the knee. So there is an in OA there's a degeneration of the articular cartilage, as you can see here. Articular cartilage is the smooth lining that covers the ends of bones where they meet to form the joint. This cartilage gives the knee joint freedom of movement by decreasing friction. But as you can see here in this illustration, if this one breaks down, if this one wears and tears, there will no longer be a cushion that will be protecting this bone, causing pain to occur once the bone will rub against another bone. The cartilage, or articular cartilage, is kept slippery by a joint fluid made by the joint lining. This is known as the synovial membrane. While the fluid is known as the synovial fluid, it is contained in a soft tissue enclosure around the synovial joints called the joint capsule. And an important substance present in articular cartilage in synovial fluid is called as the hyaluronic acid. The hyaluronic acid helps joints collect and hold water, improving lubrication and reducing friction. So this is what it does together with the synovial fluid. They help lubricate the joint of our help lubricate our joints in order for us to have easy movement. It also acts by allowing cells to move and work within the joints. And as you can see here in this joint, since there is the cartilage has worn away, you can see that there will be bony spurs that will grow from it due to the constant rubbing of bone against bone. So when the articular cartilage degenerates and wears away, the bone underneath is uncovered and rubs against the other bones. And like what I've said earlier, once that happens, these small outgrowths called bone spurs or osteophytes may form at the joint. This will further aggravate the pain that the patient is going to feel. So changes in the cartilage and bones of the joint can lead to pain, stiffness, and use limitations. That's why patients who have osteoarthritis are have difficulty in moving because if they move their joints, they are going to experience pain. So deterioration of cartilage can affect the shape and makeup of the joint so it doesn't function smoothly. Limp when walk or have trouble going up and down the stairs, so they may limp while they walk. If they go up and down the stairs, they have difficulty. This causes also fragments of bone and cartilage to float in joint fluid, causing irritation and pain. Cause bony spurs called osteophytes to develop near the end of bones, and this means that the joint fluid doesn't have enough hyaluronan, which affects the joint's ability to absorb shock. So if they jump, for example, they are also going to experience pain because that fluid that is absorbing the shock from a jump, for example, is no longer there. It is deficient. Not only the knees can be affected, even the hip joints, since there are also cartilages there. Causes and risk factors. Again, the cause of osteoarthritis, there's no single known cause of it. But there are several risk factors. Age. As we grow older, the more that we are put at risk of developing osteoarthritis. Another would be obesity. Of course, if one is obese, this will the weight bearing joints of the body will have wear and tear, especially for obese people. So if you're obese or overweight, sa Tagalog, mapupudpud yung mga cartilages dahil sa sobrang bigat ng katawan, yung weight-bearing joints ng ating katawan, yung cartilage doon mapupudpud siya due to obesity. So pwedeng mangyari yon. Those things can happen. Injury or overuse as well. Um, there was a certain point in my life wherein I was overweight and due to my line of work, teaching, I do not sit down while teaching. You all well know this by now. I do not sit down while teaching. And if I have a schedule, a whole day schedule of classes, due to constant roaming around the class, constant standing up, since I was also overweight at that time, and if my joints have been overused, this can happen. Arthritis can happen. I felt um, knee pain after a whole day of teaching several classes. So this can happen. But fortunately, when I came to Yupang, I'm no longer experiencing this since my weight already has decreased due to workout, and workout and exercise can really, really help you lose weight. So there you go. Genetics or heredity can also play a factor in the development of osteoarthritis. Muscle weakness as well, and other disease or types of arthritis can cause this. So there. Long-term complications of osteoarthritis can, of course, lead to this. There might be bowing of the legs. Wait, there's also a weight-bearing joint at our lumbar area. So the cartilages of our vertebrae can also break down. And if that further happens, it will cause arthritis at the lumbar region of our spine, of our vertebrae. How do we manage this? Of course, weight reduction. Weight reduction, because the weight bearing joints of our body is the one suffering this type of arthritis, like our knees, our hip joints, our lumbar vertebrae. During that time when I was overweight and teaching, not only more my knees were in pain, even my lumbar area was also in pain. So, um, what you need to do if you're suffering from these signs and symptoms, you need to lose your weight. And if you have a job that requires you to stand for prolonged periods of time, you need to rest every now and then. You need to rest your weight bearing joints. Use of splinting devices also to support joints. Occupational and physical therapy may help, and pharmacologic management. So here, um, these pads, warm pads, can help relieve the pain brought about by osteoarthritis. Paraffin wax therapy as well. Remember, if for paraffin wax, this is hot. Heatness can relieve the pain of the joint, especially if they are experiencing the joint pains in their fingers or hands or their wrist. Sense as well can help in relieving pain from patients. So TENS stand for transcutaneous electrical nerve stimulation. But instead of this, just an example, instead of it being placed here on this area, they are going to place these pads on the joints that are experiencing pain. Let's say, for example, the knees or the lumbar area in order to relieve pain. So they will introduce a small amount of electrical current through these pads in order to relieve pain. Physical therapy as well. So there's no treatment to stop the erosion of cartilage in the joints, but there are ways to improve joint function. One of these is physical therapy to increase flexibility and to strengthen the patient's muscles around the affected joints. And the therapist may also apply hot or cold therapies such as compresses to relieve pain. So, if the patient is suffering from chronic osteoarthritis, we can refer them to physical therapists at the hospital so they can help relieve pain. Supportive devices such as Finger splints or knee braces, like this illustration here, they can reduce stress on the joints and ease pain. If walking is difficult, canes, crutches, or walkers may be very helpful. People with osteoarthritis of the spine may benefit from switching to a firmer mattress and wearing a back brace or a neck collar. So even the cervical spine can also be affected. So these corsets, the lumbosacral corsets, can help ease pain in a patient who is suffering osteoarthritis of the lumbar spine or the lumbosacral area. Osteoarthritis and weight. If you are overweight or obese, one of the most effective ways to relieve pain in the knees or hip joint is to shed a few pounds. That's what I did before, because weight is a big factor in the wear and tear of the cartilages of the weight bearing joints. Even modest weight loss has been shown to reduce symptoms of osteoarthritis by easing the strain on the weight bearing joints. Take note, I was overweight at around or during my early 20s. Mom Sherry knows this because I was working with her back then. And we have pictures together that can show my chubby face and all. And after a whole day of teaching, I will experience joint pains. And weight loss has given or has uh, proven to me that um, osteoarthritis can be treated by doing weight loss. Imagine, I was that young, early 20s, I was already suffering from this osteoarthritis. I would complain of joint pains on my knees and my lower back, lumbar area. And when I started working out, lost a couple of kilos, that's when I stopped feeling joint pains of the knees, of the back, and so on. Because even sitting for a long period of time can cause lower back pains on my part. But I'm no longer experiencing that. Losing weight not only cuts down on pain, but may also reduce long term joint damage. So if you are overweight and are experiencing joint pains, this is effective weight loss. Osteoarthritis and exercise. People with osteoarthritis may avoid exercise out of concern that it will cause pain, but low impact activities such as swimming, walking, or bicycling can improve mobility and increase strength. Training with light weights can help by strengthening the muscles that surround your joints. For example, strengthening the quadriceps can reduce pain in the knees. That's what I did. I did weightlifting exercise and cardio exercises. So with these exercise, jogging and cycling alone. When I was abroad, one of the exercises that I did was jogging and cycling. I had my bike there. Aside from that, I did weightlifting exercises. I am doing barbell squats. Squats help me a lot to strengthen my leg and thigh muscles. Now, after a jog, unlike before when I was jogging, when I was still overweight, I am experiencing knee pain. But now, after a jog of 30 minutes, I'm no longer experiencing that because it has strengthened my lower extremity muscles. So I am a testament on how weight loss and exercise can help eliminate the pain brought about osteoarthritis. Treatment is one, NSAIDs, acetaminophen, or topical analgesics such as topical salicylates or capsaicin. Acetaminophen is like paracetamol, but it's a different brand name or generic name in America. It's more common than paracetamol in America, but here paracetamol is one of the things that can help relieve pain. Or other NSAIDs such as COX-2 medications such as celecoxib. These are examples of COX-2 medications. Tramadol can also help, or even narcotic pain relievers, but that's the last resort for narcotic pain relievers because narcotics can cause respiratory depression. They can also be addictive. Okay, so number one thing that you can offer to patients would be NSAIDs. There are different types of NSAIDs: paracetamol, acetaminophen, aspirin, mefenamic acid, ibuprofen, the COX-2 medications. There are a lot of them, and most of them are over the counter. If you see Manny Pacquiao advertising about Alaxan and telling about relief of joint pains, this is true. So you can use any of these non-steroidal anti-inflammatory drugs for relief of joint pains. Articular steroids will also help decrease inflammation. So steroids will be injected into the affected joint. I'll show you that later. Hyaluronans such as hyaluronate, Hyalgan, and Adhylan GF20, cyclobenzapine, hydrochloride, glucosamine, and chondroitin sulfate can help as well rebuild the cartilage that has been worn away. So this is an example of acetaminophen. Usually the first choice. Tylenol is the brand name. Here, paracetamol is available in the Philippines. I've already mentioned this. Prilosec can also be given, brought about by NSAID-induced ulcers. Because remember, aspirin, mefenamic acid, you need to tell patients to take these medications with food because they are acidic and they can further cause gastric irritation if taken on an empty stomach. So, in order to prevent these drugs from being given to patients, such as Prilosec or omeprazole, you need to tell the patient to take certain NSAIDs, such as mefenamic acid and aspirin, to take them with food. Diclofenac sodium can also be given to reduce pain. We have topical NSAIDs here. Capsaicin, it's an ointment prepared from the active ingredient of hot chili peppers. This is what is making chili hot or spicy. This chemical component found in chili, capsaicin, and it's helpful in relieving painful areas in other disorders. Salon Pass patch with capsaicin is also helpful. So Salon Pass or pain relieving patches is very, very helpful in reducing pain from arthritis. You can also use other topical pain relievers such as those containing menthol like Omega or efficacent oil here in the Philippines. Tramadol, it's all I've mentioned this, not as addictive as narcotics, but maybe an alternative for patients who do not respond to NSAIDs or less potent agents. So take note of the side effects of tramadol here. I don't need to mention them one by one. They're already self-explanatory. Narcotic pain relievers such as oxycodone, oxymorphone, and morphine. If NSAIDs do not relieve the pain from patients suffering from arthritis, narcotics can be given. But take note, you need to watch out for respiratory depression. When giving narcotic pain relievers, you always prepare the antidote, which is naloxone Narcan. Just in case the respiratory rate goes below 12. cycles per minute. Um, just read on the rest. The adverse effect that I want you to focus at in oxycodone or the other narcotics would be slowed breathing or respiratory depression. Supplements. Overall studies suggest that benefits of glucosamine and chondroitin supplements, which is available at pharmacies and health food stores, they are touted for relieving pain and stiffness for people with osteoarthritis. They're also advertising this that it promotes the healing of the torn cartilages. So you check with your doctor first before using chondroitin, especially if you are taking um, blood thinners or what do you call this? Drugs such as heparin or warfarin, the anticoagulants. Intraarticular steroids such as betamethasone or celestone methylprednisolone, depomedrol, or triamcinolone, Kenalog. These steroids they will be injected to the affected joint to further decrease the inflammation that is happening in there. Surgical treatment may be also done. So arthroplasty may be done on patients who really have um, damage, joint damage brought about by osteoarthritis. So to prevent osteoarthritis from developing, the most important thing you can do to ward it off is to keep your weight in check. Over the years, extra weight puts stress on the joints and may even alter the normal joint structure. Preventing of injuries is also important and take precautions to avoid repetitive motion injuries on the job. If you play a sport, use proper equipment and observe safety guidelines. Or if you have a work that will constantly need you to do walking or standing, you need to sit every now and then to prevent the wear and tear of your joints. Now we go to rheumatoid arthritis. This is classified as a diffuse connective tissue disease, and it's an autoimmune disease of an unknown origin. It is classified as a diffuse connective tissue disease and is chronic in nature, and it is characterized by diffuse inflammation and degeneration in the connective tissues. So what happens here is it's autoimmune. The body's own immune system is the one that is attacking the joints this time. So the pathophysiology here is that in RA, the culprit is the immune system, and it primarily occurs in the synovial tissue. Phagocytosis produces enzymes within the joint, leading now to the breakdown of the collagen, causing edema, proliferation of the synovial membrane, and ultimately pannus formation. Okay, so as you can see here, the pannus formation found in between these two bones or in the joint will is made up of granulation tissue, and it will further obliterate that articular space. So that pannus destroys the cartilage and erodes the bone, as you can see here from this illustration. The consequences of this are loss of articular surface or joint motion. And further degenerative changes can occur. So muscle fibers undergo degenerative change, and tendon and ligament elasticity and contractile power are lost. So as you can see here, even osteoporosis can occur, brought about by um, rheumatoid arthritis. So here, the whole immune system is the one that is responsible for attacking the joints of the body for an unknown cause. So statistics, Rheumatoid arthritis is common worldwide and it affects 1% of the population. Ratio of female to male with rheumatoid arthritis is 2 is to 1 or 4 is to 1. So it's more common in females than in males. Causes, like what I've said, it's unknown, but genetics can be a factor. Researchers have shown that people with specific gene marker called the HLA shared epitope with fivefold greater chance of developing rheumatoid arthritis than do people without the marker. So genetics, infectious agents as well. Bacteria and viruses may trigger the development of a disease in a person whose genes make them more likely to get it. Female hormones. So 70% of women with RA are, or people with RA are women. And these occur because of the fluctuations of the female hormones. Environmental factors such as exposure to cigarette smoke, air pollution, and insecticides can occur. Or workers who work with silica or mineral oil may harm the worker and result to contact dermatitis. So occupational exposures. Clinical manifestation, joint pain, of course, is the classic sign of rheumatoid arthritis. Swelling. So once the joint swell, there will be limitation in function. Warmth. If you touch the affected joint, you can feel warmth upon palpation and the joints are spongy or boggy. There is also redness or erythema at the affected joint. Loss of function because of the pain, this will further immobilize the area. Deformities of the hands and feet may occur because of misalignment resulting in swelling. Rheumatoid nodules can be present in patients who have more advanced RA. They are non-tender and movable in the subcutaneous tissue. So complications brought about by medications that are used to treat rheumatoid arthritis can have adverse effects, such as bone marrow suppression. Improper use of immunosuppressants can lead to this, since the immune system in this type of disease is overreactive. So we give immunosuppressants, but this can cause bone marrow suppression. If bone marrow suppression can occur, anemia can happen. Example of those immunosuppressive agents are methotrexate and cyclophosphamide. They are highly toxic and can cause bone marrow suppression, leading to anemia, even pancytopenia. When we say pancytopenia, anemia, what else? Leukopenia, which is decrease in WBCs, and thrombocytopenia can occur or decrease in the thrombocytes or the platelets. Gastrointestinal disturbances can occur if NSAIDs are being used and the patients were not properly taught about these NSAIDs. That's why we need to do patient teaching about certain NSAIDs that they need to take this with food. I've already mentioned to you what type of NSAIDs needs to be taken with food. Diagnostic findings in the diagnosis of RA, one of the things that needs to be done would be anti-nuclear antibody titer or NAA titer. Screening tests for rheumatic disorders elevated in 25 to 30% of RA patients. Follow-up tests are needed for the specific rheumatic disorders such as anti-RNP in order to it is used for differential diagnosis of systemic rheumatic disease. Rheumatic factor or RF, it will be positive in more than 80% of cases, such as doing the Rose-Waller test. Agglutination reactions, it's positive in more than 50% of typical cases with RA. Serum complement, the C3 and C4 is increased in acute onset, the immune inflammatory response. Immune disorder or exhaustion results in the depressed total complement levels. And to detect for inflammation, the ESR is going to be done. Erythrocyte sedimentation rate, it's greatly increased at around 80 to 100 millimeter per hour. It may return to normal as symptoms improve. So it means that the patient really is suffering from inflammation if the ESR is increased. CBC may usually reveal moderate anemia. WBCs are increased due to the inflammatory process. IgM and IgG are elevated. It suggests that the autoimmune process is the cause for rheumatoid arthritis. X-rays are also going to be done to detect for soft tissue swelling, erosion of joints, and osteoporosis of adjacent joints or adjacent bones. These are early changes. And it will progress later to bone cyst formation, narrowing joint space, and subluxation. Concurrent osteoarthritic changes may also be noted. So X-ray is also important in the diagnosis of this disease to detect for changes in the joints of the patient. Radionuclide scans can also be done to identify the inflamed synovium. Direct arthroscopy, visualization of the area reveals bone irregularities and degeneration of joints. So they need to visualize this with an arthroscope. They are going also to do synovial fluid or synovial fluid aspirate. They are going to aspirate the synovial fluid and check if the volume is greater than normal. The synovial fluid should be clear, but for patients with RA, it's opaque or cloudy and it is yellow in appearance. It means that there is an inflammatory response happening in the joint. If blood is present, then there may be bleeding. There are also degenerative waste products present in the aspirate. Elevated levels of WBCs and leukocytes can be seen, and a decreased viscosity and complement C3 and C4 are present as well. Synovial membrane biopsy, so it reveals inflammatory changes and development of panos. They can assess that from the biopsy. This is the inflamed synovial granulation tissue, which I've shown you earlier. Management. Patients with RA should rest and exercise. So, like what osteoarthritis is managed, rest and exercise is very, very important in patients who have RA. We refer them to community agencies such as Arthritis Foundation, which could help the patient to gain more support. Biologic response modifiers as well, which is an alternative treatment approach for RA. So biologic response modifiers has emerged wherein a group of agents that consist of molecules produced by cells of the immune system participate in the inflammatory reaction. So in biologic response modifiers, it's like immunosuppression as well, but here they are known as immunomodulators. They give interleukins or cytokines which will modulate the immune system in order to regulate it from further attacking the joints. Therapy, a formal program with occupational and physical therapies prescribed to educate a patient about the principles of joint protection, pacing activities, work simplification, range of motion, and muscle strengthening exercises. We can refer them to physical therapists as well in order for their pain to be relieved by physical therapy. Nutrition. Food selection should include the daily requirements from the basic food groups with emphasis on foods high in vitamins, protein, and iron for tissue building. Next, now we go to the drugs for rheumatoid arthritis. Again, same drugs can be given to them, NSAIDs and COX-2 medications. I've already mentioned them in order to reduce inflammation and relieve pain from the patient. COX-2 medications are better than the other NSAIDs because they Also, um, what do you call this? Protect the stomach lining from further being irritated. Methotrexate is currently the standard treatment of RA because of its success in preventing both joint destruction and long-term disability. So that's one of the drug of choice in rheumatoid arthritis. Methotrexate is also being given to cancer patients, but they can be given to patients who have RA to prevent bone destruction. Analgesics, the NSAIDs, again, back to the NSAIDs. Or if there's chronic pain, they can give or the doctors can prescribe narcotic analgesics. Moderate erosive rheumatoid arthritis, cyclosporin or Neoral is an immunosuppressant that is added to enhance the disease-modifying effect of methotrexate. For patients who has persistent erosive rheumatoid arthritis, corticosteroids are helpful. Systemic corticosteroids are used when the patient has unremitting inflammation and pain or needs bridging medication while waiting for slower DMARDs to begin taking their effect. DMARD stands for disease modifying anti-rheumatic drugs. These are drugs that are specifically given to patients who have rheumatic diseases. Advanced and remitting rheumatoid arthritis, immunosuppressants are given. Immunosuppressive agents are prescribed because of their ability to affect the production of antibodies at the cellular level. Antidepressants can also be given for most patients with RA. Depression and sleep deprivation may require the short-term use of low-dose antidepressants such as amitriptyline, paroxetine, or sertraline in order to reestablish an adequate sleep pattern and manage chronic pain. Remember, for patients who have rheumatoid arthritis, the chronic pain that they might feel can cause them not to sleep. Reconstructive surgery can also be done, same thing as that with osteoarthritis. So, when pain can no longer be relieved by conservative measures and the threat of loss of independence is imminent, reconstructive surgery will be done. Synovectomy can also be done, which is the excision of the synovial membrane. Tenorrhaphy is the suturing of the tendon. Arthrodesis is the surgical fusion of the joint. And arthroplasty, which is the surgical repair and replacement of the joint. So any of these surgeries can be done if just in case there's a problem with the synovial membrane, the tendon itself, or the whole joint itself. Now we go to gouty arthritis. So it is a disease characterized by abnormal metabolism of uric acid, resulting in an excess of uric acid in the tissues and blood causing inflammation. So people with gout either produce too much uric acid or more commonly their bodies have a problem in removing it. So the major concern in this type of arthritis is the too much uric acid in our body and the inability of our body to excrete it out, also known as gout, the disease of kings, or the king of diseases. There are two major types, primary and secondary. For primary gouty arthritis, there's an inherited X-linked trait, so it's related to being passed on by females, caused by several inborn errors of purine metabolism. Uric acid is the end product of purine metabolism excreted in the urine. So production of uric acid exceeds the excretion capability of the kidneys. And sodium urate is deposited in the synovium and other tissues, which results in inflammation. And gout can occur in males, commonly occurring in males who are in their 30s and 40s. While secondary gouty arthritis affects all ages, hyperuricemia can occur. There's excessive uric acid in the blood caused by another disease such as renal insufficiency, diuretic therapy, multiple myeloma, or carcinomas. But initially, because of renal insufficiency, there's a renal problem. That's why there is inability of the blood to excrete out uric acid. So, causes decreased normal excretion of uric acid and other waste products, and increased production of uric acid. Now we go to the four stages of gouty arthritis. We have asymptomatic hyperuricemia, acute gout or acute gouty arthritis, interval or intercritical, and the chronic tophaceous gout. We start out first with the symptomatic hyperuricemia, which is the first stage. Like from the word itself, it is asymptomatic, but if you are going to check the uric acid levels in the blood, it is elevated. So, uric acid levels is at milligrams per deciliter. So, if it is more than 9 milligrams per deciliter, incidence of gout is at 7.0 to 8.9%. If it's around the serum uric acid levels is 7.0 to 8.9, there's a lesser incidence, 0.5 to 0.37%. But if the uric acid levels are below 7 milligrams per deciliter, there's only 0.1% of the patients who have incidence of gout. Now, the second stage, acute gout or acute gouty arthritis, this is now the first attack of GA. Hyperuricemia has caused deposits of uric acid crystals into the joint space, leading to gouty attacks. So, excruciating pain and inflammation of one or more joints, especially here, the metatarsophalangeal joints of the fingers or the great toe, the great toe or podagra can occur. So these fingers, the toes can have deposits of uric acid crystals in it, and inflammation will occur. That's why bringing about increased erythrocyte sedimentation rate together with increased WBCs. Note, excessive alcohol and fat starvation diets can cause acute attacks of gouty arthritis. So if you have gout and you are also drinking too much alcohol, alcohol can further aggravate the pain that you're experiencing from gout. So here, like here, this is the one that I'm talking about. This is podagra, wherein the joint of the big toe will be swollen and inflamed, brought about by uric acid or uric crystal deposits at that joint. Common sites of acute flares would be the olecranon bursa, or the elbow, the wrist and the fingers, the knees, the ankles, subtalar, and the midfoot. Now go to third interval or intercritical. This is the periods between acute gouty attacks, maybe months or years after the first attack. This is an asymptomatic period, so no abnormality in the joints are seen. So in the interval or intercritical, there are no signs and symptoms being felt by the patient. But once it proceeds to the fourth and last stage, chronic tophaceous gout, this disease has caused now permanent damage to the joints. Deposit of uric crystals under the skins and also within major organs can occur. And there may be uric kidney stone formations as well. So tophi, there will be deposits of sodium urate crystals. It can occur anywhere, even in the outer skin, as seen here in this picture. And you can see here, look at the joints of the fingers and the toes. These are tophaceous gout. So a case of misdiagnosis of gout is mistaken for rheumatoid arthritis. So patient originally diagnosed and treated for rheumatoid arthritis for 8 years. Um, it can be mistaken for RA, but in truth, the patient here is suffering from polyarticular tophaceous gout. Differential diagnosis: the tophi can be mistaken for a rheumatoid nodules. Both disease can present as polyarticular symmetric arthritis. That is why it is very, very important to do or to check the blood serum levels for uric acid in order to differentiate rheumatoid arthritis from gouty arthritis. Because if the serum uric acid levels are increased, that is not rheumatoid arthritis. That is indicative of gouty arthritis. Now, we are going to do patient teaching on how to avoid foods that will trigger or that will cause further buildup of uric acid in the body. Since gout commonly strikes people between the ages of 30 to 50 and more occurring in men and less in women in menopause, we teach patients to avoid foods that are high in purine and keep the weight down as well. What are these foods high in purine? We have anchovies, yung dilis, so i-avoid nila yan. Herring and sardines are avoided. Mushrooms, asparagus, peas, and beans are avoided. So legumes are avoided. Legumes. What are legumes? These are beans. Black beans, munggo, what else? Kidney beans, red beans, and so on. Basta lahat ng klase ng beans, they should be avoided by patients. I had an uncle who, or have rather, have an uncle who's suffering from gout. If he sees that our food, yung ulam namin, munggo, aayaw na kaagad yun. Because he knows the consequences of eating munggo or balatong in Pangasinan. Muscles can be avoided. Kidney, liver, heart, and brain. Organ meats, they are high in purine. Another, if we have this dish present and our uncle again is going to eat with us, pag nakita niya na ang nakahain egado, aayaw na naman siya. So, organ meats are avoided by patients who have gout. Gravy, sweetbreads, and broths, and consomme, they should be avoided. Alcohol as well will further increase the production of urates and uric acid, and it interferes with its excretion. So tell patients to avoid alcohol. The hyperuricemia cascade. So dietary purines, the tissue nucleic acids, and endogenous purine synthesis will contribute to the production of urate. Overproduction of it and under excretion can lead to hyperuricemia. There will be silent tissue deposition leading to gout. So there will be tophaceous gout formations of the joints. Renal manifestations can occur and associated with cardiovascular events and mortality because these crystals they can also be deposited in the other organs of the body. Diagnostic tests, they are going to aspirate for synovial fluids. If it shows uric acid crystals, then that means that the patient has gout. If it shows there is WBC, increased WBCs and um, what do you call this? Degenerative tissue destruction, that's another thing that may be from rheumatoid arthritis. So uric acid is also elevated in the blood. X-rays may be normal. Synovial biopsy can be done to check if it's present for the uric acid crystals, and if uric acid is also present in the urine. Diagnosing gout, I've already mentioned those things to you. Management, drug and diet therapy. A combination of this is very, very important. So, drug therapy for gout would be we give these things. NSAIDs are also helpful together with colchicine. Colchicine is one of the drug of choices for gout, and it is taken for 4 to 7 days together with NSAIDs such as indomethacin, ibuprofen, naproxen, and celecoxib. Painkillers such as codeine, hydrocodone, and oxycodone can also be given, and together with corticosteroids. Chronic or repeated acute episodes, we can give uricosuric drugs such as allopurinol and probenecid. These drugs will help lower down uric acid in the blood. Or a combination drug such as probenecid and colchicine can be given. So these uricosuric drugs will help decrease uric acid in the body, such as allopurinol, probenecid, together with colchicine. So these uricosuric drugs, they promote the excretion of excess uric acid and promote uric acid excretion in order to reduce its production. Allopurinol or xyloprim is a xanthine oxidase inhibitor which prevents the conversion of xanthine into uric acid. That enzyme, xanthine oxidase, this enzyme is used to convert xanthine to uric acid. So once you give allopurinol, it will cause this xanthine to not be converted into uric acid. Probenecid, Benemid, or Benuryl is if you are taking this, you take with at least 2 liters of fluid a day while taking this medication to prevent uric acid kidney stone formations. Aspirin, do not give aspirin with probenecid and colchicine because it inactivates the drug. Take note of that. So never give aspirin while the patient is in probenecid and colchicine. Monitor the serum uric acid levels as well. So these are examples of those drugs: allopurinol and probenecid. Febusoxstat, Uloric. This is the new medication developed specifically for the gout control of gout in over 40 years. So this decreases formation of uric acid by the body and is a very reliable way to lower the blood uric acid level. And it can be used in patients with mild to moderate kidney impairment, but this should not be taken with 6-mercaptopurine or azathioprine. Yang febuxostat. So this is it. This comes in tablets. Diet therapy. This is controversial, but it's very, very helpful in monitoring or lowering down the uric acid levels of the blood. So, avoid those foods that I have mentioned earlier, especially alcohol, organ meats, and legumes. Limit protein intake as well and avoid alcohol and fat starvation diets. Why is starvation diet dangerous? They only provide 300 to 700 kilocalories only per day, which must be supplemented with high quality protein. Given the risk of death through cardiac arrhythmia, starvation diet should be limited in duration. Adverse effects are orthostatic hypotension due to loss of sodium, decreased norepinephrine secretion, fatigue, hypothermia, cold intolerance, scleroderma, as you can see here in this illustration, hair loss, and dysmenorrhea. Fad diet, any number of weight reduction diets that either eliminate one or more of the essential food groups or recommended consumption of the one type of food in excess at the expense of other foods. So fad diets rarely follow the modern principles of losing weight. So I've advise patients not to follow fad diets. They should strictly avoid foods that are rich in purines. I've already mentioned these: legumes, mushroom, spinach, asparagus, cauliflowers, baking, and brewer's teas are avoided as well. Limit meat. Avoid fatty foods such as salad dressings and ice cream and fried foods. Eat enough carbohydrates, and if losing weight, lose it quickly. Quick weight loss may cause use it slowly rather. You lose weight slowly because quick weight loss may cause uric acid kidney stones to form. It should be around 1 pound per week. 1 pound per week when losing weight. So these are examples of low purine diet. Just read them. Group one, those you need to take in, um, those that are recommended for patients who have gout. Group two, use in moderation. While group three, they should avoid these type of foods because they are high in purines. All forms of aspirins and diuretics may precipitate attack, so avoid using them. And excessive physical or emotional stress can exacerbate their disease. So do not tell the family members not to stress the patient. It's very, very important for patients to increase their fluid intake to prevent stone formations at the kidneys. And this will also dilute the urine and prevent sediment formation. That's why increased fluid intake of 2 liters of fluid per day is important. Alkaline ash diet as well is needed. Citrus fruit, juices, and milk, and certain dairy products can be given. Uric acid is more soluble in high pH urine and will less likely form urinary stones. So it's very important to stress to the patient to take in citrus fruits, juices, and milk and other dairy products. Complications can bring about chronic gouty arthritis. Kidney stones can occur. So watch out for that. Development in the kidneys will lead to chronic kidney failure. So watch out for uric acid crystals in the kidneys as well. So that's it, everyone, for the different types of arthritis. So good luck on your upcoming exams. I hope you have read all of the concepts under perioperative nursing. So the coverage of your exams will include both perioperative nursing and the different types of arthritis under ortho. Again, thank you for listening for today's lecture on the different types of arthritis, and have a great day, everyone. Good luck on your exams. Bye.